Hello and welcome to our webinar from the Institute for Research on Poverty at the University of Wisconsin-Madison. I'm Dave Chancellor and I'll be your host today. So we are recovering a really important topic here, looking at the impact and current state of the COVID-19 pandemic in prisons and correctional institutions. And we've got a great panel with us today. So we're going to be hearing from Dr. Amanda Klonsky and Michael Everett of the UCLA Law COVID Behind Bars Data Project. Professor John Eason of the University of Wisconsin-Madison Justice Lab and Professor Danielle Wallace of the Center for Violence Prevention and Community Safety at Arizona State University. And finally, Professor Kristin Turney of the University of California, Irvine Prison Pandemic Project. So I want to thank all of you for being here. I also want to thank the Office of the Assistant Secretary for Planning and Evaluation for their partial support of this webinar series. That said, any positions expressed in this webinar are not necessarily those of ASPE, any other agency of the federal government, or the Institute for Research on Poverty. So we have an hour today, and we're going to take about the first 45 minutes or so for presentations, and then we are going to turn to your questions during Q&A. So you'll see that there's a Q&A box at the bottom of your screen, so you can click that, type in questions as we go throughout the webinar. We also have the chat box open today, so if that's a way that you want to participate, or if you want to share resources or discuss in other ways, you're absolutely welcome to do so. We are recording today's webinar, so if you're looking for that recording, we should have that out by tomorrow morning, and we're going to share some of the slides and other resources that you might find valuable as well. So finally, we do have closed captioning or subtitles enabled, and so if those are useful to you, you can toggle those on or off at the bottom of your screen with that CC button at the bottom there. So with that, let me introduce Dr. Amanda Klonsky and Michael Everett of the UCLA COVID Behind Bars Data Project. Dr. Klonsky is a research and policy fellow there, and she's worked as an educator in prisons and jails for over 15 years, and she's been particularly engaged in work addressing the huge challenges of the pandemic in correctional settings in the US. Michael Everett is a data scientist at the COVID Behind Bars Data Project and a James K. Colby Memorial Fellow at Dartmouth College, where he works on the intersection of artificial intelligence and the US criminal legal system. So I'm so grateful that the two of you are able to join us and start off this discussion today. And Michael, let me invite you to share your slides if you want to do so.
Thanks so much for having us. So I'm Amanda Klonsky. I'm the Research and Policy Fellow with the UCLA Law COVID Behind Bars Data Project. And with me is Michael Everett, the data scientist with the project. He'll introduce himself in a second. Since March of 2020, our team has been tracking the pandemic in jails, prisons, and detention centers across the United States. Our project is led by Professors Sharon Dolovich and Aaron Littman at UCLA Law. We collect and analyze public information about the coronavirus pandemic in jails, prisons, youth facilities, immigration detention centers, and other carceral facilities across the United States. Our centralized source of data enables greater oversight and accountability for carceral institutions' response to the pandemic behind bars, and we also record legal and community responses to the crisis, including mass releases, legal filings, court orders, and organizing efforts. Our project is contracted to provide all the data to the Centers for Disease Control about the spread of COVID-19 in carceral facilities in the United States. Slide, please. So I think it's important to note here that racial bias permeates the US criminal legal system in every aspect of its system. And we see the collection of data on the impact of COVID on incarcerated communities as essential for furthering health equity and racial justice in the United States. Most jails and prisons in the United States do not report data broken down by race or ethnicity, including health data. This makes it challenging to understand racial disparities in health outcomes in all of their complexity. And this is one of many reasons why we join researchers and advocates who have called for increased data transparency from carceral agencies. To obscure this data from public view undermines public health efforts and efforts to end the pandemic. Next slide, please. In March of 2020, many of us who have worked in jails and prisons recognized that the conditions in jails and prisons would be prime for spread of a highly contagious respiratory virus. American jails and prisons are unsanitary and overcrowded. They lack adequate ventilation. Social distancing is impossible in settings where people often sleep head to toe in large dormitories, in bunk beds, who share bathrooms, who share phones, hundreds of people sharing a single phone, and where healthcare is inadequate at best. We anticipated that jails and prisons would provide the ideal conditions for this virus to spread, and in fact, we've seen those nightmarish predictions come true. Since the early days of the pandemic, American prisons have been responsible for many of the biggest COVID-19 outbreaks in the world. In the past 19 months, we have seen jails, prisons, and detention centers become taxpayer-funded engines of the pandemic. Now, Michael's going to walk you through some of our big picture data findings from the project.
And hi, everyone. I am Michael. I hope everyone can hear me okay. I was having some problems unmuting myself, so apologies if there are any problems with that. I am a data scientist on the team and work alongside Amanda, bringing in our data, analyzing our data, and presenting it to the public. So for the last year and a half, we have gathered, centralized, and harmonized COVID data posted by various carceral agencies using approximately 150 plus web scrapers and a data infrastructure that's all hosted on GitHub on a tri-weekly basis. We have also built up the backend data infrastructure and other data sets like facility populations and geocoding to make analyzing this COVID data about what's going on in carceral facilities easy and accessible for researchers, policymakers, journalists, and families. We also have an interactive website to explore our data, which we hope you all will check out and utilize with all of our reports and research. And this just gives an idea of the types of websites that we're scraping, pulling, and aggregating together into one central usable data set for researchers and anybody hoping to understand the state of the pandemic behind bars. Over the course of the last year and a half, we have tracked a prolific spread of COVID through US carceral facilities. We're hoping in this presentation to give everyone that is attending this webinar a feeling and summarize a few studies highlighting the impact and disparity of how these cases have impacted people behind bars and incarcerated communities and those that work in them. And also to highlight some challenges with the data reported by carceral agencies, which makes assessing COVID's full impact on people behind bars more difficult and often impossible. So some general facts about the impact of COVID on incarcerated communities. So our data show that incarcerated people are both far more likely to be infected from and to die from COVID than the general population. This is about 3.3 times more likely to be infected in the general population and about 2.5 times more likely to die from COVID. On June 6, 2020, the relative risk of being infected by COVID in carceral environments was 5.5 times greater in prisons than the general population, and that has sustained itself throughout the pandemic, showing that prisons are very risky environments for COVID. They are not safe environments for COVID, and they create disparate impacts and health outcomes for individuals that have to stay there during the pandemic. To understand the full mortality impact of COVID-19 on state prison systems beyond just the overall reported numbers by carceral agencies, we have tried to do in-depth studies on prison systems where we can gain access to data that would allow us to ask this question. So in the Florida prison system, in 2020, there were approximately 215 reported deaths. That was more deaths than during the past 5 years. And this is despite the fact that the Florida prison system's general population declined precipitously at the start of the pandemic. This increase in deaths contributed to a 4-year decline in life expectancy between 2019 and 2020 in the Florida prison population when we age and sex adjust the impact of the deaths. This compares with what the CDC has calculated for the general population to be around 1 year decline experienced by the total US population. So this shows that there are substantial impacts and disparities between the overall mortality impact of COVID on people in prisons, with a lot of these deaths occurring in individuals 55 and older, than what's going on in the general population. And that this is, that the official numbers of just COVID numbers miss the full impact of deaths and mortality in the prison systems. And I'm going to hand it off to Amanda to talk about our research project studying disparate COVID-19 outcomes by race.
So as I mentioned, racial disparities permeate every aspect of the criminal legal system. And so of course, we have reason to suspect that there are racial and ethnic differences in COVID outcomes among incarcerated people. However, data on COVID-19 by race is not widely available. Most departments of correction don't report it. and so this can be difficult to assess. One goal of our project is focused on obtaining these data and increasing data transparency and public accountability from carceral systems. Where we do have the data, there's strong evidence of tremendous racial disparities. In Texas, for example, the age standardized COVID mortality rate in prisons is 1.5 times higher for incarcerated people who are Black and 2 times higher for incarcerated people who are Latinx when compared to white incarcerated people in Texas prisons. So we see big differences. Michael.
Yeah. Great, thanks, Amanda. I just want to make sure you got all that. And in terms of staff, alongside the racial impacts of COVID or disparities of COVID behind bars, for the last 19 months, COVID has been the greatest threat to staff and or correctional officers who work in jails and prisons. There have been at least 130,000 corrections workers that have been infected with COVID-19, and the rate of infection for prison workers is more than triple the rate of infection seen in the general population. In spite of this, prison administrators have generally failed to successfully achieve very high rates of vaccination among their staff, and in many states that report these numbers, less than 50% of prison staff may have reported giving a shot, and we'll have some more slides on that. So to summarize also, along with what we've been able to say from our data, which is a lot of these health and disparate impacts on people behind bars and people that work behind bars, it is important to note that there's a lot that we can't say. Infrequent testing in jails and prisons has made it very likely that there is a drastic undercounting of COVID behind bars. This is a great piece by the New York Times that shows that while there's great regional variation in infection rates across prison state systems, there's also great variation in the number of times somebody that is incarcerated can expect to be tested for COVID-19, which again, if you're not consistently testing, you're likely not catching all of the cases inside your system. High case fatality rates in some states, further suggest that many COVID infections have likely gone undetected inside prisons. Several prison jurisdictions report COVID case fatality rates, or deaths over cases, higher than the overall US case fatality rate, even before demographic adjustment, where prisons have a smaller population of individuals 65 and older. That lends evidence that prison systems are undercounting the total number of COVID cases behind bars. Again, or the overall US case fatality rate is around 18 deaths per 1,000 cases. Not only do we have issues with the amount of testing for COVID, but also with general health data coming out of correctional agencies, there are discrepancies and issues. So an examination of medical records conducted by Texas Justice Initiative and also some work done by us suggests that there are 64 more deaths from COVID inside Texas prisons than reported officially by agency officials. Those numbers are inconsistent, and generally those kinds of inconsistent, missing, vague, and redacted forms of data on prison deaths and deaths in carceral settings make assessing the true toll of COVID behind bars challenging. Even more, many agencies fail to report data essential for understanding the state of COVID behind bars. We've been conducting scorecards where we kind of rate states on what they're reporting. Example of data that should be included for us to understand the state of COVID behind bars include cumulative case and death rates, tests administered, vaccine administered, ideally by facility. A lot of states don't post this data. You can see that many of the states, at least state prison systems, get a failing grade for the data that they post. Florida, for instance, stopped posting data altogether in June, even though its incarcerated population only had a vaccination rate of approximately 45% at the time. And they have refused to continue posting data after that point, even though people are still dying of COVID behind bars in that system, they're just not posting on them. And even when agencies report numbers like a cumulative case rate or cumulative cases, sometimes that number isn't a true number of cumulative cases. They'll decline over time because people are released from the system. So there are a lot of complexities with the data that agencies post, and it makes it very difficult or report if they do report it, and it makes it difficult to harmonize and create cohesive analysis of the state of COVID behind bars from it. So I'm going to pass it off to Amanda to talk about the current state of COVID behind bars and what we're seeing in the future.
Thanks, Michael. So for 19 months, COVID has been by far the greatest threat to the safety of people who work in jails and prisons. At least 130,000 prison workers have been infected with COVID-19. And again, the rate for prison workers is more than triple the rate of infections seen in the general population. In spite of this, prison administrators have failed to successfully achieve high rates of vaccination among their staff. In most states that report these data, less than 50% of prison staff have reported getting a shot. The crisis has only been escalated by especially high rates of vaccine refusal by public employees who work in jails and prisons. And they're putting incarcerated people and over-policed communities of color at continued and preventable risk of COVID-19 outbreaks. Ultimately, they put everyone else in harm's way too. As we've seen repeatedly with tuberculosis and other infectious diseases, outbreaks in jails and prisons inevitably spill over into surrounding communities. COVID-19 is no different. Neglecting incarcerated people's welfare multiplies disease and amplifies epidemics, causing harm to everyone. Thanks, Michael. In recent months, we've started seeing jail and prison populations start to creep back up or flatline after a 14% population decline in the first half of 2020. Prison population declined only slightly from the fall of 2020 to spring of 2021. Jail populations have increased about 13% from mid-2020 to spring 2021. Prison population drops during the pandemic were largely the result of fewer admissions, not releases. And many prison systems are still operating well above capacity. For example, the California Department of Corrections is still operating at 107% above capacity. Public health experts have made clear that reducing the number of people behind bars is a crucial step toward ending the pandemic. Research demonstrates that large-scale decarceration would protect both incarcerated people and people who work in jails and prisons, as well as the broader communities that surround jails and prisons. But for 19 months, lawmakers have largely ignored these appeals. As a result, COVID cases in US jails and prisons are once again surging, and conditions for those who live in or work behind bars are increasingly dangerous. Michael, can you wrap us up?
Thank you, Amanda. So as a project committed to data transparency and researching health disparities within carceral environments, we hope to continue as long as we can and continue to put out our data in an open source, reproducible, and in a way that's fully accessible to the public. We believe that for data transparency initiatives to work, it should be open source, and that everyone should have access to the data that we're using. So in the long run, people can replicate what we're doing, and we can better understand health disparities within correctional environments. We really hope that you will look at our website and also our GitHub, our website UCLA Behind Bars and our GitHub by the same name. This is where we post our data. And we also have put our various R packages or our R package and various other scripts that show how to pull, analyze our data. And we hope you'll reach out and research our projects to our reports to better understand the impact of COVID behind bars. And thank you for your time.
Thank you so much, Amanda and Michael. You covered so much ground there, and I just really appreciate you kind of starting us off there.
Thanks for having us.
Yeah, absolutely. Danny, if I'm going to invite you to start sharing your slides here. But next up, we're going to hear from Professor John Eason and Professor Danielle Wallace. Professor Eason is a sociologist here at the University of Wisconsin-Madison. He's also an IRP affiliate and directs the UW-Madison Justice Lab. Professor Wallace is an associate professor in the School of Criminology and Criminal Justice at Arizona State University. And she's also the associate director at the ASU Center for Violence Prevention and Community Safety. So thank you both for being here. I really appreciate it.
Dave, thank you so much for putting this together. I'd like to thank the other panelists as well. We're really excited to present our research on this panel. I think we can pick up right where Amanda and Michael left off. I'd like to start this presentation like I do most of my presentations by talking about the criminal justice system and the footprint of it overall. So more than about 6 out of 10 Americans know someone in prison or jail, and 8 8 out of 10 African Americans know someone incarcerated, right? The odd thing is, you look at this map, the very odd, peculiar thing that most people don't know is that prisons not only are or the incarcerated population is not only overrepresented with African Americans, so are the communities that build prisons. So during the peak of the prison boom, the probability of getting a prison increase with the percent of African Americans in a rural community. That's a paper I published in 2010. We also know that in 2019, there were over 450,000 corrections officers, and 35% of them were Black. So as far as getting the details of the racial data that Amanda and Michael have discussed, those trends pretty much speak to Black people being locked up more, Black people working in prisons more, and prisons being in Black communities. And so this graphic you're looking at, we knew this very early on. We looked at the community spread of, we were looking at COVID cases by community, and we just mapped these. I'm an IRP affiliate of Yona's here. I want to say thank you to him for this map. We've been using this forever. He's the IRP mapper. And this shows prisons, counties with prisons, and then the infection rate. This is very early on in the pandemic, the surrounding community infection rate. So I'm going to turn it over to Danny to describe the specifics of one of the several papers, one of the 4 papers that we have either published or under review with NSF funding. So next slide, Danny, and I'll let you go to it.
So one of the things that we wanted to examine was the relationship between prisoner infection rates and staff infection rates within a prison. Staff members represent a bi-directional vector of spread. They leave the prison every day at the end of their shift, and they come back when their next shift starts. So they can bring COVID into the prison, and they can bring COVID outside of the prison to the community in which the prison sits. Prison policies regarding infection control, whether that's mask mandates, visitation policies, whatever it may be at that prison or within the prison system, play a role in how COVID spreads within the prison, but importantly, potentially among staff members and prisoners that often share space together. Here's a tragic example of something that really brings home the reason why it's important to think about correctional officers as a function of spreading COVID within prisons. During the summer slowdown of COVID in 2020, in August, there was a wedding reception in Maine, and one of the guests worked at the local county jail, York County Jail. The guest returned from the wedding, worked 5 consecutive 8-hour shifts while showing symptoms of COVID and didn't take any time off. The staff member became one of the first confirmed COVID cases in that jail, which then led to 82 additional cases being tied to the jail through inmates, other staff members, and the family members of the staff members working at the jail. And at the time, Maine did not require staff to wear masks when on duty. So this is an excellent example of how correctional officers can facilitate a cluster event within prisons, but also kick off a chain of events related to infections. So given this setup, what we did is we asked a very simple question. Is there any temporal trend between the rates of staff infections and incarcerated persons' infections within a prison? So I'm going to show you some time-related graphics about federal prison systems, which is what we studied, related to what Amanda and Michael noted. Data is difficult to come by, and the federal system reported daily rates of COVID prevalence among staff members and their prisoner population. And we were able to scrape that off the web to give us a really long lens, a long timeline into looking how these dynamics work within prisons. So this is the federal prison system. And I want to point you to the orange graph, orange line rather, which is the staff rate. The staff rate increases and stays higher regarding their rate of positive active cases of COVID per 1,000 staff members, higher than prisoners throughout the federal prison system through the timeline of this particular study, which we take out to the end of January 2021. Prisoner infected persons, they always are have ups and downs, but by and large, the staff rates tend to get kicked off first, and then we see bumps in incarcerated persons in their rates. But this is a system graph. It kind of masks what happens within each prison. So I want to show you these graphics by level of security of prison. So this is a minimum security prison, Morgantown FIC, Federal Correctional Institute. And what we see now is the staff are the blue line, and that we see bumps in staff infection rates over time, followed by significant outbreaks among the incarcerated population. So to prevent outbreaks, one method could be to really control staff rates of infections in some of these prisons. And we see two massive outbreaks at Morgantown, one starting in the beginning of December and then another in mid-January. Minimum security prisons are those where there might be work release, there's a lot of staff prisoner contact, the grounds are more open. Then we look at Seagoville FIC. Seagoville is a low security prison, is one of the largest outbreaks in the prison system that the US experienced. At its high point, this top rate is 775 active cases of COVID per 1,000 prisoners for a 75% infection rate right around the end of July. So that means there's COVID literally floating in the air at this prison during this moment. But you can see down at the bottom that the staff rates started to slowly increase, which then followed by the massive Seagoville outbreak in the county, or in this particular facility. Cumberland FIC is a medium security facility where there's lower levels of staff prisoner interaction, and yet we constantly see that staff outbreaks go first, or staff rates increase first, followed by large upticks in the prisoner rate. And then finally, the only type of facility that we saw in our work that didn't have this relationship was the high security prisons, where staff and prisoners don't interact that much. And this is, we saw massive outbreaks among the staff, with the incarcerated population experiencing rates of COVID, but just nothing like what the staff were experiencing. So we ran some models to help us understand how these two rates are related over time. And descriptively, what I just showed you is that we often see that positive staff COVID rates increase before the prisoner rates do. And in our models, we do show that the staff rate of infection from 14 days before has a significant positive relationship with prisoners' rates. So there's an uptick in prisoners' rates as the staff rate upticks as well. Moreover, the severity of the pandemic is related to the county in which the prison sits, right? So this goes back to John's opening point, is that the county rate where the prison sits impacts how the staff rate impacts the prisoner rate. So the county effects and the community levels of COVID flow through the staff members and onto the prisoners. And even when the staff positive rate is low, meaning there's no actively known, and that known part is important because testing is a sort of fluid scenario. When the staff known rate of COVID is low or at zero, we still see a relationship between the staff rate and the county rate on prisoners through potentially pre-symptomatic and asymptomatic spread from staff to prisoners. And finally, during our study period, masking became a policy that was invoked in the federal prison system late August. And masking reduced the transmission, but in a small way, through an average drop of about 1% in staff and prisoners' cases. This is suggestive of problems with organizational adoption of masking and inconsistent use of masking, or perhaps bad masks, or not as great masks, or something along those lines, that it wasn't necessarily a strategy that truly had a diminishing effect on what was happening. So now I'm going back to John.
Um, we had a number of policy recommendations across a few of our studies. We're going to highlight a couple of them here for you. So we want to start with thinking about the prison and prison system as an institution that needs protection. And so this is really taking a public health approach to understanding an institution that's primarily concerned with public safety. And those two things, those two objectives often conflict. So we understand that this will be particularized. The policies need to be thought about within the context of each state, because over 83% of all prison facilities are run by departments of corrections, state department of corrections, only 5% are federal. So, and if we think about the prison system as a system that needs to be protected from the pandemic, where it's going to take a drastic culture shift, a drastic culture change. Even before the pandemic, as Amanda mentioned earlier, the prison was prone to infectious disease, not only in addition to Hep C and HIV. I think roughly around 20% of all Hep C and HIV cases in the US today can be linked back to correctional institution. So we need to do a better job of thinking about public safety as in terms of public health. And even changing, I just saw a comment, and I want to end here to make sure that Kristin has enough time. Even changing the discourse from talking about inmates to people, right, and thinking about them as incarcerated people, there's a huge issue. If there's only more than 450,000 corrections officers, I'm forgetting the exact number that Michael put up there. I think it was around 130 or 140. The math, that's fifth grade math, right? You just do the fifth grade math on this, and that's over 40%, up nearly 50%, if not over 50% of our correctional officers have had COVID, right? That's how high that rate is, right? So we have to think about these institutions as containing people. People work there, people live there, the staff and the incarcerated persons that are in their care. And they're disproportionately Black, not just people of color. The communities where these facilities are, the people in the facilities who work and live there are overwhelmingly Black. So with that, we'll close, and we look forward to hearing your questions and comments. Thank you.
John and Danny, thank you so much for that. And I think that really dovetails nicely with what we heard from Michael and Amanda before. Next, I'm really happy to introduce Professor Kristin Turney, who's a sociologist at the University of California, Irvine. Professor Turney is an IRP affiliate as well. And she's on the team doing behind the important work of UC Irvine's Prison Pandemic Project. And I'm really looking forward to hearing more about that. And so welcome, Professor Turney. Oh, you're muted there.
Sorry. Thank you so much for the invitation, and to my fellow panelists as well. And I think these three talks really they gel really nicely together. So inspired in part by some of the same numbers and information highlighted by the other panelists, a team of us at UC Irvine started Prison Pandemic sort of early on in the pandemic as a response to the crisis, the COVID-19 crisis in carceral facilities. Prison Pandemic, right now it's a website. You can go to our site, prisonpandemic.uci.edu, and it aims to provide one of the first discoverable and ethical sources of knowledge about how those who are currently incarcerated have experienced the COVID-19 crisis. People who are incarcerated behind bars are traditionally really silenced voices. It's really difficult for them to be able to share their stories. And with Prison Pandemic, we've collected contributions from people incarcerated across the state of California. The stories that we've collected span across time. So we started in fall 2020 collecting stories, but have retrospective accounts from the beginning of the pandemic. We're still collecting today. And the stories also span across place, covering all of California's 35 state and 10 federal prison facilities, jails across most of the state's 58 counties, and all of the state's 9 immigrant detention facilities. We think about COVID-19 in carceral facilities as a public health crisis within these facilities. So like you've heard from the other panelists, people who are incarcerated are particularly vulnerable to COVID-19. They have had inadequate PPE at the beginning, particularly at the beginning, sort of middle of the pandemic. They have difficulty social distancing because of the conditions and the overcrowding and just the nature of life in prisons and jails. We know that they were living in substandard conditions prior to COVID-19. And we know that people who are incarcerated generally are people who have a number of health vulnerabilities sort of predating, potential exposure to COVID. We also think about COVID-19 in carceral facilities, similar to others on the panel, as a racial justice issue. We know that there are striking race ethnic inequalities in the prevalence of incarceration, with Black men, for example, 7 times more likely to spend time in prison than white men by their mid-30s. And the devastating toll that COVID-19 has had in prisons and jails is situated in within this historical and contemporary context of institutional and structural racism. So you've seen a version of this already. This comes from the CDCR, California Department of Corrections and Rehabilitation website. And you can see here that in the sort of the bluish green line is the CDCR, the number of confirmed COVID-19 cases. That's the number of people who were infected with COVID-19 per 1,000 people in the population. And you can see that that number is quite a bit higher among people incarcerated in California prisons compared to people in the United States more generally, sort of the non-incarcerated population, or in California specifically. So this is sort of information you've already seen today, but I think it just highlights the stark just sort of disparities in COVID-19 in prisons. And of course, we suspect as well, like others have already mentioned, that these numbers that are reported on the CDCR website are certainly an underestimate. Prison pandemic, I want to just sort of take a step back and tell you about the beginning of prison pandemic. So our team of researchers, we initially started prison pandemic as an immediate response to COVID-19. So members of the project team, including myself, were contacted by people who are incarcerated and by staff who worked in these facilities in California who wanted to be able to share their stories and their experiences during the pandemic, which definitely put COVID-19, put this on our radar as something we were sort of already thinking about. But hearing the personal accounts just really made us think that we had to do something, right? So hearing these accounts, oops, sorry, that's my Siri. Always some technical difficulties. So we wrote some op-eds to try to raise awareness about COVID-19 in carceral facilities in California. And we did a fundraiser through UC Irvine where we raised almost $10,000 that we donated. We purchased PPE for folks who are incarcerated and donated it to some of the local facilities around here. But in doing that, so in doing the fundraising, we, put together a video to try to raise awareness. And in doing so, we talked to a number of folks who had been recently released from prisons across the state. And we just realized that there was this incredible need for people who wanted to share their stories and the stories that we were hearing from them about how the pandemic was unfolding across the prisons across the state was just devastating and horrifying, and we felt that we had to do something about it. So the team, the sort of core prison pandemic team, spans across the schools of social sciences and social ecology at UC Irvine. My colleagues Karamet Ryder and Naomi Sugia are in the Department of Criminology, Law and Society at UCI. And then we've been working with very, very closely with two amazing graduate students also in criminology, Joanne DeCaro and Gabe Rosales. We've also had support by a number of graduate students over the past year, year and a half, and we've worked with about 200 undergraduates to get the website up and running. And I'll tell you a little bit about how we do that. So the first stage is that we conduct outreach to prisons and jails as well via mail. So we write letters to people who are incarcerated. We have worked very closely with community organizations, and we have put ads in prison newsletters in order to tell people about Prison Pandemic and let them know how and where they can share their stories. We collect these stories in two primary ways, mostly through a hotline and a PO box. We have a hotline that runs Monday through Friday from 5 to 9 p.m., which is staffed by undergraduate volunteers. And we have a PO box where people can write letters to us. You can also share your story via our website, via submitting something on the website directly. And we're also working with some folks who want to donate submissions to us as well. Once we get the stories, we process them for inclusion on the website by redacting. This is a very convoluted multi-step process that involves redacting the identifying information from people so that we can share their stories anonymously, transcribing the phone calls and the letters, voicing the letter, so providing a narrative of the letter, a verbal narrative of the letter so we can put it on the website, and creating shorter topical segments tagged with relevant themes. I'm going to present here. I'm just going to show you, I'm just going to play about a minute of a clip from one of the stories that's featured on the website. To date, we've collected nearly, more than 4,000 letters and phone calls. We've got some of them up on the website, but are working furiously to process all of the materials we do have. And, we'll be getting everything up as soon as we can. I'm just going to play one of the stories for you that's on the site. This is from a man who's incarcerated at Chino State Prison in California, which is about 40 miles from UC Irvine.
Well, California Institution for Men, CIM, was one of basically the starting points for COVID within the CDCR, the California prison system. The cases started here back in early March of this year. The yard that I'm on currently, Facility A, we didn't start really seeing an impact until sometime in April. We had a building go on quarantine. Basically, they didn't handle anything. They just put a building on quarantine. We still mixed with the individuals. The buildings here, there's 8 on the yard. The buildings can house 160 inmates in a wide open dorm setting. The bunks are about 42 inches apart, less in some situations, and they are double bunks. There's virtually no ventilation in the building, no air circulation. On April 30th, they decided to drop the population in the buildings. And so they took approximately 30 inmates per building and just called a bunch of names. I was one of the names at this time that got removed from my building.
So this is just a slice of the approximately 15-minute phone call that the caller shared his story and his experiences of COVID in one of the California prisons. We also, like I said earlier, we have phone calls that are average about 15 minutes. That's the longest a person can call us for. We have a collect call line set up so they can call us via that, and we also have thousands of letters, which on average are about 4 pages long. With Prison Pandemic, we really wanted to center the voices of incarcerated people, like I mentioned earlier. These voices are traditionally censored by prison authorities. are met with research accessibility challenges. Prisoners are a protected population, of course, and their voices are traditionally stigmatized as well. Because of all of these reasons, it's very difficult to collect, share, and amplify the personal stories of people who are incarcerated, which is really what we have been able to do with PrisonPandemic. Certainly, there's been ethical considerations from the very, very beginning. So at the very beginning, we worked with UCI. We worked with UCI Legal Counsel to address some of these issues, and we've worked very, very closely. We have a community advisory board comprised of mostly formerly incarcerated people, some family members of formerly incarcerated people, who we consult with at every step along the way. So just a couple of things that we've done with guidance from them, and our own. Obviously, we've spent so much time thinking about this, but we clearly communicate to contributors how their stories will be made public, that their stories would be made publicly available, right? So when they call us, we let them know that. When we write them letters, we also let them know that. We also ensure anonymity, and we've taken steps to protect the archive from legal threats, thinking about subpoenas or people requesting identifying information or things like that. We view our audience as really, really multi-dimensional and interdisciplinary. So we think about our audience as being scholars, but we also really, really think about our audience as being the media, advocates. Some of these stories are being used by the ACLU, for example, right now, undergraduate students as well. So we're working to develop some teaching materials and the broader public. So the more we can do to share the site and get it out there in the broader public, the better. In terms of what's next, so I'll just say really briefly as I wrap up, PrisonPandemic began as an immediate and frantic, to be completely honest, response to a crisis. We hadn't done this type of work before, and we were frantically trying to figure out, how to do it and how to do it in the best way possible across lots of domains. And so it's pretty frantic. And now we have been able to take a step back and think about what's next. And we are working to transition from collecting stories to preserving stories. So we're working really closely with UCI Libraries, Special Collections, and Archives to archive all of this information in a permanent and preserved way. We're also working to make some fairly big changes to the website to increase accessibility and searchability. And we're doing a lot of outreach. So we've connected with a lot of humanities folks across campus. So outreach via social media, of course, but also we're working with literary journalism at UCI to develop a podcast. We're working with the drama department to develop a play. We're doing a 3-week exhibit later on in the spring quarter at UC Irvine, where we'll be able to display some of these stories. And then finally, we're also doing some more research related work that dovetails really nicely with the work that the other presenters have talked about today on COVID-19 related mortality in carceral facilities across the United States. And that was inspired by, of course, some of the work that is being done at UCLA, but also the sort of narrative information that we've collected across the state. So with that, I just want to thank all of our funders and our small, we've been working on a shoestring budget. Thank the funders, but really thank the people who've contributed their stories and the amazing team of students at UC Irvine who've really worked to make this happen. Thank you.
Kristin, thank you so much. And if I can just invite the other presenters to turn on their cameras as we sort of transition to Q&A here. Thanks everyone that's been participating in chat and with your questions. As a start, and I think this is kind of a common theme throughout what we've been seeing, there are a lot of questions regarding sort of data transparency and just accessing this information. I think that's probably been something that all 3 of these projects have dealt with in some way. Michael, I'd love for you to kind of lead us off there. You talked about some of the challenges in getting data from states on these factors. So what have you found, and what are some of the focuses that you've had as a data scientist working on this?
Yeah, that's a very broad question. I'll try to be concise. It's a struggle, but yeah, so we work primarily gathering data from carceral agencies regarding COVID, and that takes usually one of 2 forms. We scrape it from their website, or we request it from them and gain it directly from the agency. General reflections on that. Agencies are not posting the same level of data. When we reach out to agencies and try to talk about, productively what we could need, it often takes a while or is not that productive. We have requested cumulative case counts from the Bureau of Prisons that don't take out numbers, so they decline over time. And they scheduled our request as complicated and said they'd reply in 6 to 9 months. So from a public records perspective, a lot of this data is really difficult to get. Often it's impossible to get. If you request it and it's not posted or reported, it can be redacted or difficult. And that's not to say that there aren't agencies that are really lovely in many ways and or that the other ones aren't in terms of some people there, but they really transparently will give you good data. And we've used that to kind of request the same quality of data from other jurisdictions for things like our mortality research. But I'll let Amanda speak a bit more also, if she has any reflections on data transparency. But it's a struggle. I think it gets better when we have open source platforms that are working to consolidate the data in one place and then allow data scientists to make a claim for it from carceral agencies because it already exists, right? If you already have a massive data set from one agency that's reported in a certain way, you can request that from another agency and they'll say, they can't say that it doesn't exist or that other DOCs don't reasonably keep track of that information. So that's one strategy we've used, but obviously it's imperfect and we haven't been able to get everything that would be very useful to understanding COVID.
Okay. Amanda, did you have more that you wanted to add, but I also want to make sure that we have time to hear from
Please
John
ask
and Danny.
other questions. Sure.
Okay, yeah, okay. So John and Danny, did you have anything that you wanted to add? I mean, I know Michael's response kind of reflected their situation there. What did you see in your work?
So we've had many of the same experiences. We've worked primarily with the BOP. However, we scraped the data from their website. And, we've experienced the same issues. FOIA requests have come back to us in very short order, but in very, very opaque terms that don't necessarily answer what we asked for. But I think importantly, I want to add that a lot of what correctional departments are reporting are not the statistics that go into standardized epidemiological rates. So we get a lot of prevalence statistics and not incidence statistics, which makes it far more difficult to track because prevalence statistics is everybody that was infected the day before, or maybe the day before that, and everybody who was infected today. So it's really difficult to understand that end over end changes, what cases got added on a daily basis, what people tested negative on a daily basis. It's not the same quality of information that, say, is being collected among the population at like Johns Hopkins for us to understand these rates. So the data coming out of most correctional departments is not the stereotypical epidemiological information that helps us track these rates in a really traditional way that matches what the CDC is doing. So there's not a one-to-one translation there. So it isn't just about transparency, it's also about what's getting collected and what's getting reported.
The data quality itself is often based on the strength of relationships that researchers have with departments of corrections and the capacity of those departments of corrections. And so, this will map onto where we probably have lower rates of COVID as well. So states that I would typically say are doing better inside the prison and jail system who actually are tracking this, it means that they're probably doing a better job of mitigating this. We won't be able to uncover the full, and I'm using this term not pejoratively, I mean, I'm using it literally, the full autopsy of what happened with COVID in places like Mississippi and Alabama and Arkansas, where I've done research as well, because their refusal to collect data or share data, Florida in particular, is going to make this very difficult. I do want to give one bright spot because you have more practitioners here and you have a bunch of wonky nerds on this panel. And we're just like, we'd like our data to be a little better and cleaner. There are cases where if you can form a relationship with the local correctional facility where you can get administrative data, and I've done that here in Dane County, working with the Dane County CJC, Criminal Justice Council, but they're very forward thinking. This is a very liberal space for them to be able to have a cooperative data agreement with Malia Jones and I, another IRP affiliate, and we're looking at COVID in confined spaces there. So just to get to that data, it takes a lot of meetings and researchers willing to ingratiate themselves with these administrators. And even then, as Danny has pointed to, the quality of data depends on where you're getting it from, and that varies widely.
Okay. I want to turn to Kristin really quickly, just to give her an opportunity here. So, Kristin, you're a sociologist. And this project has really taken off in probably ways that it doesn't seem like your team maybe imagined at first. How have you thought about just giving people the opportunity to tell these stories, and what are some of the really common themes that, that your team has talked about in terms of how these are collected and sort of the maybe long-term value that you're seeing there?
Yeah, thanks, Dave. Yeah, I am trained as a sociologist and really trained as a demographer, quantitative sociologist. So this has been a bit of a departure for me and for the other members of my team. So the learning curve has been steep, but incredible. And the team is great. In terms of the themes that we're seeing, so we spend a lot of time, we would love people to use this as a resource, right? And to use the archive as a resource. I teach a course, for example, on medical sociology, and have been able to incorporate the Prison Pandemic website into the course and into course assignments, thinking about the social determinants of health and things like that. And so we would love for people who are kind of working in the academic space to be able to, use this as a resource, use this for their students to learn so much about what's going on, and highlight the inequalities that we see that are, highlighted if you just peruse it on the website just a little bit. The other thing I think that we would like is that we would really like this to be used by people who are out there making policy, by practitioners, by people who are on the ground, by people who are interacting with incarcerated people, formerly incarcerated people, their family members, et cetera, and the people who are working in these facilities as well, to be able to, what is the low-hanging fruit? Like, there is some low-hanging fruit about what we can do sort of policy and practice-wise to just simply stop infection or reduce infection, right? And certainly the more that people can sort of hear the sort of on-the-ground lived experiences of those who are incarcerated, could go a long way in terms of thinking about policy and practice.
Okay. I want to go next to, we've had a few questions asking about correctional settings where there are shorter stays, maybe less record keeping. Danny's responded a little bit of this in the Q&A box there, but how are we thinking about juvenile facilities, Huber programs, other sort of visits, and how does that all track in this? And Danny, I want to give you the first shot at that if you would. So
it was a really great question, looking at these other areas in which, we track individuals that have had contact with the criminal justice system. And what I do know of is that in the data that we collected from the Bureau of Prisons, which will eventually be publicly available, I think in the next 6 months or so here, maybe 8 months, depending on preparing data for public release at the end of a grant. It's got its own issues, but there is residential facilities that the BOP has, which are, I believe, a bit like halfway houses, and they've been tracking those numbers as well. The difficulty with understanding COVID rates in those places is that they also don't release population totals and staff numbers in those facilities at a regular basis for us to truly understand how many staff are there, how many prisoners are there, for example, and the ins and outs of the dynamics in those places. So while we have some numbers in those places, it's a start. It's not, it might be difficult to understand what's truly happening there. And if any of the other panelists know of other data collection efforts, I'd be interested in hearing about them.
So we're low on time, but I want to turn to Amanda really quickly because Amanda, you've been working in this space for a long time, and I think a lot of what we're seeing here sort of map onto challenges that have been long-standing in the prison system, and I'm hoping you can kind of help us think a little bit about that and maybe some of the policy issues that you think should be highlighted moving forward out of this pandemic.
Sure. Well, I think we mentioned two of them at the close of our presentation. One is that we know we cannot bring the pandemic under control in the United States until we address the conditions behind bars. That means that we have to create programs and policies that rapidly and dramatically reduce the number of people who are held in jails, prisons, and detention centers in the United States. We know it can be done safely. We know that the majority or thousands of people in the United States who are held in prison can be safely released. And we have to find the moral courage to do it. So now more than ever, it's urgent, because the longer we delay, the worse this crisis becomes. We're seeing that we cannot bring the pandemic under control as long as we have engines of the pandemic and constant outbreaks in our communities in every county in the United States, right? First of all. Second of all, I think it's important to remember that we still haven't seen effective vaccine uptake or mandates in most jails and prisons in most jurisdictions in the United States, right? That we have seen the people who are the most impacted, right, most likely to become sick or die of COVID, who work in jails and prisons or who are incarcerated, repeatedly infected because of the resistance of people whose job is supposed to be to protect public safety, and who are resisting and refusing to become vaccinated, right? They're endangering everybody. So we need vaccine mandates, we need mass vaccination campaigns, and we need to see large-scale decarceration efforts become a meaningful and real effort in the United States in this moment, right? Not just someday, but right now, right? And I think we heard from Professor Eason why this is also an urgent issue for racial justice, the advancement of racial justice movements in the United States, right? So I think those are the things I'm really thinking about right now, and where my commitments are in this emergency. And I just want to say one more thing, which is that we keep talking about this, not on this panel, but in the larger public discourse right now, as if the pandemic is ending or as if the pandemic were over. And that is absurd. And I hope that people who are listening today, if you take away one thing, it is that as long as we have 1.7 million or 1.8 million people, most of them Black and Latinx, behind bars in the United States, this pandemic will not be brought to an end. It will not happen. And so this threat of mass incarceration, the crisis of mass incarceration, is endangering all of us. Okay. Anyway, thank you. It's been an honor to be here in conversation with all of you.
I know we're low on time, a couple minutes over, but I do want to give, that was such a beautiful sort of wrap up thought and so helpful, Amanda. I want to give the other presenters a quick opportunity to sort of like, what do you want to leave us with? And Michael, can I go to you next on that one?
Yeah, I don't want to take up too much time with, I think Amanda's answer was great in a lot of ways. It covers a lot of the issues that we're seeing where the data is bad, but it's indicating that this is a serious threat to US public health. And if we ignore it, that ignorance is going to have racial disparities and other forms of amplifying the various ways that the system already fails, but on a much greater level and with, far greater risks to those communities that are disproportionately policed and incarcerated. So I echo a lot of what Amanda had said and would encourage or reach out to the other excellent panelists to also share their insight.
Okay. Danny?
I was about to echo both Kristin and John that she said it
okay.
amazingly.
Okay.
So
we're covering this in chat and we're saying that we don't need to follow Amanda on this one. And so with that, I am so grateful for the 5 of you taking the time to share this super important work with us, with our audience. And I appreciate everybody that joined us today. Again, we are going to have the recording out for this by tomorrow morning. We're going to share a number of other resources related to the presentation. So with that, thanks to everyone that was here. And thanks so much to our presenters for this important work. Okay, bye now.
Great job, everybody.
Thanks for having us. Lovely to meet all of you. Take care.
thank you so much.
Pleasure.